Attention, so please come to order. Senator Murray is on her way and has suggested that we go ahead. She'll be here very shortly. She and I will each have an opening statement, and then we'll introduce our panel of witnesses. And after our witness testimony, senators will have 5 minutes of questions. Today we're discussing the importance of the issue of mental health and substance use disorders. Mental illness affects a great many Americans. According to a 2013 report from the National Survey of Drug Use and Health, nearly 1 in 5 adults over the age of 26 reported suffering from a mental illness. In that same time period, nearly 1 in 10 Americans between the age of 12 and 17 reported having at least one major depressive episode. In Tennessee, about 1 in 5 adults reported having a mental illness in 2013. That's more than 1 million Tennesseans, according to the Tennessee Department of Mental Health and Substance Abuse Services. About 5% had a severe mental illness. That's nearly 250,000 Tennesseans. About 41,000 Tennesseans had a major depressive episode. Already there's an enormous response to try to help at the state level by the private sector and by the federal government. As a former governor, I know firsthand that states have traditionally been on the forefront with their departments of mental health, their treatment facilities, and community-based services. States have had the primary responsibility for behavioral health and provide community-based programs that often include counseling, case management, social work, and provide screening, diagnosis, and treatment for children. And in the private sector, there are many private hospitals, nonprofits, mental health professionals, and others working to help those in need. Efforts from the private sector totaled about $67 billion in 2009, or 39% of total dollars spent for behavioral health, which includes mental health and substance use services. Government spending totaled about $105 billion in 2009, or 61% of total dollars spent, and that includes Medicare, Medicaid, and other efforts on the local, state, and federal levels. One role the federal government plays is through its agencies. The Substance Abuse and Mental Health Services Administration is an agency within the U.S. Department of Health and Human Services. Its role in supporting mental health programs is relatively small compared to the responsibility that states have and the role of Medicaid, but it's also critically important. SAMHSA supports states, behavioral health care providers, and others by improving the availability and quality of prevention and treatment services, collecting behavioral health data, and sharing best practices through evidence-based initiatives. SAMHSA should be looked at as a leader in the field. It receives about $3.5 billion each year through the discretionary appropriations process. But the biggest government role is the amount of money, and the amount of money is spent through Medicaid, which is a federal-state partnership. In 2009, Medicaid spending on behavioral health totaled about $44 billion, 26% of total dollars spent. These Medicaid dollars can be used to provide care from community behavioral health professionals, inpatient or residential treatment for children and seniors with mental illness, and help those with severe mental illness get the prescription drugs they need. In Tennessee last year, state spending for mental health and substance use disorder programs and services totaled about $555 million. About half that was spent on the state share of Medicaid related to mental health. $325 million was spent by the State Department of Mental Health. The federal government's Medicare spending also plays a role, financing 7% of total expenditures to treat mental illness at about $21 billion a year. These Medicaid dollars can help seniors get prescription drugs they need, or can be used for doctor's appointments, outpatient therapy, and a small fraction of inpatient treatment for mental health. So this federal support already is a significant amount of money. So one question for today is, should we be spending these dollars differently? Or should we be spending more dollars? And if so, in what ways? There are calls for the federal government to act differently to help those in need and to do more. Twice the Senate Health Committee has passed different versions of the Mental Health Awareness and Improvement Act that Senator Murray and I have co-sponsored, once last Congress and again just last month. This bipartisan legislation supports suicide prevention and intervention programs. It helps train teachers and school personnel to recognize and understand mental illness. works to reduce the stigma against those struggling with mental illness, and helps children recover from traumatic events. I hope the Mental Health Awareness and Improvement Act will be passed by the Senate and become law this Congress. Other senators are also tackling the issue of how to improve mental health treatment. Senators Cassidy and Murphy have a mental health bill they introduced in August. Senator Franken has introduced a couple of pieces of legislation. Senator Cornyn has a bill that he's working on the Judiciary Committee. So I expect to see the HELP Committee report additional legislation in the coming months that better supports states in addressing mental health and substance use disorder in their communities. And then we will see what other committees are doing, what the Judiciary Committee might be doing, what the Finance Committee might be doing on Medicaid and Medicare, and see if putting all of those together, we have a better coordinated response toward mental health. Today's hearing, though, is really to better understand the federal government's role in mental health treatment and how it can help states like Tennessee meet such high need and deliver such critical care. I'm looking forward to hearing from today's witnesses. Are there administrative things we can do, programmatic things? Are we putting up roadblocks? How are our federal programs working? I'm particularly interested in your thoughts on mental health research. One of the most important things our federal government does is research, because that enables individuals to move forward in this big, complex society of ours. We're not such good managers. Sometimes we're not even good regulators. But government research that we've funded and encouraged has enabled enormous breakthroughs in our country. So I'd like your thoughts on that as well.